what's changed about gynecology since you started practicing, and what maybe hasn't?
Well, in the past 20 years, we've made a lot of progress in prevention of female cancer, particularly cervical cancer. What we really have not made forward progress in is decreasing preterm delivery, and also specifically with regards to Black women. Our morbidity and mortality is still astronomically high and disproportionate. So I love the fact that on this forum, we have African American women talking about how they've been impacted by lack of diagnosis, misdiagnosis, late diagnosis, and then successful management of pregnancy during lupus, because it really does take the advanced forward thinking to make that happen. So we're still being affected disproportionately, which makes this forum all the more important.
Oh, what is our role mine as a rheumatologist and yours as an OBGYN when we think about someone who's diagnosed with lupus and is pregnant?
Well, as you've said previously in the show, it's very important to have the collaborative care. A person is, number one, got to have management of their medications. And certainly better pregnancy outcomes are associated with patients who are pre-pregnancy placed on the proper medication, specifically hydroxychloroquine. And when patients are on that prior to their pregnancy, the pregnancy outcome is significantly better. But as you know, patients with lupus can face problems with kidney disease, problems with blood pressure management, and this can affect fetal growth. So it really takes a collaborative team, and that monitoring is progressive throughout the pregnancy to really have a healthy outcome for the mother and the baby.
Really quickly, just because I want to make sure our viewers are hearing, while we might have mentioned different medications, just so you know, these are not recommendations specifically for anyone. Everyone, please talk to your doctor specifically about anything that would work for your best benefit. Just so you know, and we really try not to mention specific drugs, just so no one goes, "Doctor, put me on this thing." But thank you. That was such a really, really good, important factor to consider for those thinking about being pregnant.